Okay, great to see so many people here. Good morning, everyone, and thank you for joining us for this timely and important conversation hosted by PolicyLab and the Vaccine Education Center at Children's Hospital of Philadelphia. I'm Rebecca Rosenquist. I'm the Health Policy Director at PolicyLab. College campuses are ripe for the spread of infectious disease, but many students haven't received all the recommended vaccines, which makes robust vaccination programs critical for higher education institutions. So this reality led us to team up with our partners at the Vaccine Education Center to create an evidence to action brief that reviews the challenges colleges and universities face when addressing vaccination rates on campus and lays out recommendations to strengthen vaccine uptake among students. This work inspired us to put together today's event, which goes beyond that brief. And to do so, we are joined by adolescent and young adult health, vaccine, and health policy experts, college health administrators, and student advocates who will discuss what's happening on the ground and how researchers, students, health administrators, and others can partner to increase knowledge of and engagement with vaccine efforts on campus. So a couple of reminders for all of you who've joined us, and it's great to see such interest in this event. So for all of you listening to today's session, all of your lines are muted and the video is disabled throughout the event, but we are looking forward to an engaging discussion following our panelists' opening remarks. So if you'd like to submit a question, you can do so at any time, and please do, during the event using the Q&A feature, which is located on the bar at the top of the platform. I do believe the chat has been disabled, so if you want us to see your question, please put it in the Q&A. And my colleague, Charlotte Moser, who is co-director of the Vaccine Education Center, will moderate today's event, and I'm going to turn it to her to set the stage for the discussion. Over to you, Charlotte.
Thanks, Rebecca. Institutions of higher education are unique communities for a few reasons. First, they bring together large numbers of students from diverse geographic regions, and often these students are together for extended periods of time in close quarters, like dorms and classrooms. Second, students arrive on campus at a time when they're beginning to gain decision-making autonomy, not just when it comes to their social life and their personal care, but also when it comes to their health-based decision-making. Together, these factors create an environment rife with opportunities for infectious pathogens to take hold, something we've repeatedly witnessed in campus-based outbreaks of mumps, meningococcus, and more recently, COVID-19. For this reason, vaccinations are an important consideration as institutions seek to maintain the health of individuals and the community at large. But vaccine acceptance, enforcement, and institutional support for health administrators complicate an already cumbersome task. Today, we're excited for the opportunity to hear from several experts who can help us unpack some of these barriers of today, explore tomorrow's solutions, and envision less susceptible campuses in the future. Before we get started, I'd like to introduce our panel of speakers for today. First, we have Dr. Kristen Feemster. She's the Director of Research for the Vaccine Education Center here at CHOP. She's a faculty scholar with CHOP's PolicyLab and the Executive Director of Global Medical and Scientific Affairs for pneumococcal vaccines at Merck. Next, we have Dr. Jonathan Pletcher, a pediatrician and adolescent medicine specialist who serves as the Medical Director of Inpatient Services for the Craig Dalsimer Division of Adolescent Medicine here at CHOP. And he's also an associate professor at the Perelman School of Medicine at the University of Pennsylvania. Ashlee Halbritter is the Executive Director of Public Health and Wellbeing at the University of Pennsylvania. She's also the co-chair of the Vaccine Preventable Disease Committee for the American College Health Association, or ACHA, and a liaison to the CDC's Advisory Committee on Immunization Practices for ACHA. And last but not least, we have Samantha Ratner, founder of Know Your Vaccines, head of the Student Vaccine Working Group on Ethics and Policy, and a clinical research assistant in the Department of Clinical Genetics at Columbia University. Thank you to each of you for joining us today. Dr. Feemster, I'd like to start with you by getting your perspective, because I think it's important for us to understand what the research tells us about how colleges and universities are advancing vaccine policy on their campuses and the benefits of prioritizing vaccination in higher education settings.
Well, thank you, Charlotte, and hello to everyone. Really looking forward to our discussion today. So really delighted to be here. And just before I start, I also want to note that everything that I discussed today are representing my own opinions. But when it comes to research in this topic about vaccine policy and implementation of those policies on college campuses, I think that what we know right now demonstrates why it is indeed important, where there have been some opportunities and also where there are challenges to address. And I think also really highlight what we need to better understand. And so, I'll walk through a little bit about what we've learned through some of our work, and so I think first we know that vaccine policy is important, due to some of the unique risks that Charlotte highlighted, that really provide a lot of opportunity for transmission of or exposure to vaccine preventable diseases on campuses, whether that's due to a shared living environment, social activities, occupational activities for students who might be engaged in health services, or travel. And I think not only do these factors contribute to opportunities for transmission and exposure, but this also overlaps with the time during which potentially immunity from early adolescent vaccines may be waning, as may be the case for meningococcal vaccines. And we also know that adolescents, for whom there are several vaccines that are routinely recommended, that vaccine uptake may not be ideal in many ways. And so I think all of this is, and the potential risk, right, of vaccine preventable diseases, what happens when there may be challenges to implementing vaccine policies, has certainly been demonstrated by examples of outbreaks for conditions such as mumps and meningococcal disease. For example, prior to COVID, there were a total of 75 mumps outbreaks documented between the years of 2016 through mid-2017. And then, of course, during COVID, campuses were, certainly known as settings for outbreaks. So, just talking a little bit more about some of the factors and what we know that may be contributing to some of this risk. So I noted missed vaccination in adolescents. And so, that can contribute to under-vaccinated student populations. And we do know that if you look at immunization rates, certainly amongst older teens, they may be under the objectives or goals for immunization coverage. And there are several factors that impact vaccine uptake in adolescents. We could probably have a panel on some of those issues, but certainly one is just related to transitions and care over time for adolescents. They're less likely to have a regular source of care, so maybe less likely to have opportunities to receive vaccines, especially as they get older. And if you think about some of the recommendations that for teens that might be right before college entry, they may be less likely to have an opportunity to implement or to receive those vaccines. And then we have the impact of COVID. That was a time when we saw significant reductions in immunization rates because of a disruption in a lot of health services. And that tended to impact adolescents more than younger children. And we're just starting to recover from some of that. College students may also, as I noted, there are routine immunizations that are recommended, throughout childhood and adolescence. But as you move to school or to college, that nidus of you're transitioning from your relationship you may have with your primary care provider to maybe seeking out health services on a campus. And, that is a time when there's an opportunity, right, to gain self-efficacy. But at this time of transition, many students may still rely on their parents for health-related decisions. That's something that we certainly have learned through some of our work. And so then there may be limited engagement opportunities, right, in decisions that do affect their health. And I think compounded with that, we do also know and have learned that there's limited knowledge, right, about vaccines, vaccine preventable diseases that may pose a risk for college students, and also variability in beliefs about vaccines and vaccine preventable diseases, in particular perceived risk. Some college students may not feel that they're really vulnerable or at risk for some vaccine preventable diseases, and thus may not prioritize getting vaccinated. And then there also could potentially be logistical and financial barriers to accessing vaccines as well, as they're transitioning away from, home to a college campus. Many campuses do have student health centers. I think we'll learn a lot more, I think, about all of these factors as we continue to, move along through the panel. But student health centers are not located on all campuses. Some may not necessarily accept insurance. In some of our work, we noted that about 65% accepted insurance. Students may also not be aware of available services or choose not to access those services. And then lastly, I think when we're thinking about vaccine policies on campuses, we do know that there's just a lot of variability. So there's, the vaccines that may be recommended by, the CDC or recommended bodies that pediatricians may recommend. And then there may be vaccines that a campus may recommend or even require. But there is quite a bit of variability in what those requirements may look like. So in some of our work looking at a sample of schools, we found that almost all of them did require at least one vaccine. MMR was the most commonly required, but only about half required the quadrivalent meningococcal vaccine. There were no requirements for influenza, and there was just a variety of enforcement strategies as well. And those enforcement strategies could certainly impact their effectiveness. And I think related to that, when we're thinking about what we've learned from research, we've learned that it's difficult to measure the effectiveness, right, of some of these policies to truly understand what might be most effective. And some of that's due to lack of robust data for vaccination coverage rates. We've done some work surveying college health administrators, noting that it can be difficult to fully assess the vaccine history for some of their students, resource challenges as well to ensure that the infrastructure is there to support vaccination and to and also prioritize the establishment of immunization programs as well. So whether that's supporting procurement, storage, tracking. Again, I know we'll talk more about some of these factors as we're moving forward. And so lastly, I'll just say that I think what we also know is that we do have a lot of opportunities, certainly, to continue to move forward. COVID certainly provided an opportunity to learn more about the importance of vaccine programs on campuses, right? And in some ways, I think that helps strengthen infrastructure. In some ways, it may have, led to more competition for priorities. Also, I think also amplified some of the opportunities and challenges related to vaccine acceptance and awareness as well. And so I think we've learned that there's a lot that higher education settings can do to encourage students to be proactive about their health, to engage with health services as well. And so I think related to that, this actually is a good transition. I think my time might be up to the next panelist, Dr. Pletcher, who can probably talk more about students.
Thanks, Kristen. That's great. I mean, you've already touched on so many different issues. And I know our other speakers are going to be touching on a lot of those as well. So, Dr. Pletcher, we know that you work with adolescents, and both Kristen and I touched on that health decision-making autonomy that's coming with this age group. So can you just talk about kind of the life stage that students are at in terms of that health decision-making and their growing autonomy related to such?
Yeah, thank you. And thank you so much for inviting me. And it's a great honor to be here. Of course, like Dr. Feemster, these are my own opinions based on professional experience and the available evidence, and maybe a little informed by life experience. But yeah, in terms of thinking about adolescent development and kind of how autonomy and decision making emerges through adolescence and into young adulthood, and through the lens of vaccination. I mean, we can start with thinking about preteens, and certainly preteens, approaching the age of when they can begin making decisions around vaccines, which is typically about the age of 14. Is that they're certainly being informed, by what they're hearing from parents and in the world around them. And I think it's reasonable to expect, and certainly reflects a lot of our clinical experience, that teens who enter the teenage years under vaccinated are also somewhat resistant and may face some barriers to understanding the risks and benefits of vaccines. And that may be for different reasons, right? So who are the preteens at risk for being under vaccinated? Certainly, if they have parents, right, since parents have the autonomy to consent to vaccines before the age of 14, parents who may be resistant to vaccines or refuse vaccines, their children are at risk for being under vaccinated. Children and youth who don't have parents who are able to help them and assist them and make those decisions as well, for all kinds of reasons, also may be under-immunized and have may not have been able to access primary care and not understand the risks and benefits of vaccines. But it's at the age of 14 that most teenagers, right, most teens develop the capacity, right, the cognitive ability to really begin to understand the risks and benefits of most vaccines and begin to make the decision. And certainly most states have set up, through minor consent statutes and through standards of practice and public health laws as well, have also allowed for teens to consent for vaccines. For example, in the state of Pennsylvania, given that cervical cancer is a reportable illness, it falls under the minors consent rule, where teens can consent to testing and treatment and prevention for reportable diseases. And so they're allowed to consent for HPV vaccine at the age of 14. That also would go for certainly vaccines that are required by colleges and universities. But it really isn't until the age of 18, right, at the age of 18 that we, become full citizens and get the right and full autonomy to make the decision and consent to vaccines. And as Dr. Feemster mentioned, certainly we know, and in most regards of healthcare and health decision making, most young adults 18 to 24 or so defer and rely on parents for healthcare coordination and decision making. And so it's not unusual as 17, 18, 19-year-olds or 20-year-old up to 20-year-olds are making the transition into higher learning as they're trying to complete paperwork, and we'll hear more about this, that it's really the parents that are doing most of the work. And so it's not unusual for even at the age of 19, 20, 21 for teens to really be deferring to parents to making those decisions, even though they have the full right to do that. So certainly we know that the teens who are under vaccinated and who may have resistance for different reasons weigh the risks and benefits very different in making those decisions. And so they overestimate the risks or underestimate the benefits of vaccines. But I think it's really, last thing I'll add and think about this is as we're partnering with families, as pediatricians and healthcare providers who partner with families and youth are supporting teens as they transition into their teenage years, we really try to engage in a shared decision-making model, right? It's really, really important to include even older children and young teens in the decision and understanding, so they're hearing the discussion, so that when they're certainly at the age of 13, 14, 15, they're able to participate and give their views and express their views and ask questions, so that when they're in settings where they may be one-on-one or maybe not with parents, with healthcare providers, they have the skills and the abilities to really critically weigh those risks and benefits and make an informed decision around vaccines. So thank you. I think I'll stop there and look forward to more discussion.
Thanks, Dr. Pletcher. That was great. I really like the idea of starting them thinking about those things early in conjunction with parents before they get to this point of view. Let's turn to Ashlee, who is seeing the outcomes of that or not, because of her very on the ground perspective, if you will. I know that, Ashlee, you are implementing and evaluating vaccination requirements on Penn's campus, as well as overseeing different delivery programs for vaccines. So can you just talk to everyone who's listening today about the landscape that you experience there and what you think is important for people to understand about the realities of working in campus health at this moment?
Yeah, good morning, and thank you for the invitation to be here today. Universities across the country care very much about the health and safety of their students, including outbreak prevention opportunities like vaccinations. My colleagues on this panel have done a tremendous job already of providing an overview of many of the challenges that college campuses face in trying to implement vaccines on campus. I would like today's audience to better understand three of those challenges in particular. First, that the higher education landscape is incredibly diverse. Second, that vaccine requirements are very often guided at the college and university level by local, state, and federal regulations. And finally, that vaccine requirements on college campuses is an area that is ripe for innovation. Here are some specific examples. The higher education landscape, serving approximately 20 million college students, is incredibly diverse. There are small rural institutions where you may have one part-time nurse who's managing vaccine requirements and the student body's need for general health care. There are large urban institutions who are working to review all of the childhood vaccine records that new students are bringing in, as well as trying to get their international student populations up to date with the vaccines that weren't available in their home countries. All of these professionals care very deeply about prevention tools like vaccines. Secondly, many universities set their vaccine requirements based on state guidance. As an example, in Pennsylvania, the only vaccine required for the college-age student is meningitis, and it's only required for those living in college or dormitory housing. Over the years, we have all seen the politicization of vaccines. Political influences may impact the vaccines a university is able to require of its students and can influence the ways in which universities can enforce their requirements. The third and final piece is the one that I'm most excited to talk about as we move forward in this conversation. The collection, review, and enforcement of vaccine requirements are all a very onerous process. Not all students have all vaccine records in one medical record or facility. Not all college health centers have electronic medical records. Not all electronic medical records share information easily. So much of the work on a college and university campus is manual and time-intensive, not just for college health centers, but for students and their families and trying to collect all of those records. Technological innovation could improve universities' abilities to focus on getting students caught up on vaccinations, whereas right now the emphasis is more focused on verification of vaccine history, rather than us being able to do more education and do more vaccination. So I will stop there for now.
Thanks, Ashlee. That was great. You brought some potential solutions right to the forefront of the conversation today. I like that. Samantha, let's turn to you because you bring a really unique perspective to today's discussion. Obviously, in addition to leading and your efforts to amplify student voices related to vaccine discussions, you were recently an undergraduate yourself and you lived on campus. And so you've heard the context of what the other speakers have laid out. Can you talk about your experiences with student health and what you see as important considerations, specifically when it comes to vaccine and health-related decision-making among students?
Yeah, absolutely. So I think that the most important consideration for students when we're talking about improving campus vaccination rates is really access. And what I mean by that is both the availability of vaccines for all students and also making that process as easy as possible for students. And so when I was a freshman in college, I was trying to get my flu vaccine and my meningitis B vaccine. And I went to student health and I discovered that the student health service at my school did not accept my insurance and that I was going to have to pay out of pocket for that. And thankfully, I was able to find a pharmacy in my area that did have the vaccine and did take my insurance. And so I was able to find a solution that did work for me there. But you could easily imagine that if someone wasn't able to find a pharmacy in their area, or even just didn't know that that was an option, or were less motivated to seek out other options, that might be kind of a lost opportunity to improve the vaccination rates on college campuses. And then I think that the other main consideration here, as I mentioned, is making the process as easy as possible. So in addition to providing like free vaccinations for all students, I think that it's important to, as Dr. Pletcher mentioned earlier, we want students to engage in like that shared decision making and have them take autonomy over their vaccine decisions. But we also, for students who decide to do that, we want to make it easy for them to get those vaccines and we want to encourage that. And so one of the things also when I was in college that I noticed is that there were vaccines available for things, there were like flu vaccine clinics, but you often had to make appointments to get vaccines. And they were also often not in the easiest to access locations. They were often not necessarily in buildings that people pass through a lot, and they were in kind of inconvenient locations. And so you really had to go looking for them. And I think one thing that would be a really great benefit of like having kind of like the benefit of having such like a closed campus most of the time on like 4 colleges is that students often pass through the same areas over the course of a lot of different days. And there are a lot of highly trafficked areas that could be used to have things like vaccine clinics for students. And I think that might provide almost just like a visual cue that reminds people, oh, maybe it's time for me to get a flu vaccine, without having to go through the process of planning and finding where they're going to get a vaccine, kind of taking that logistical load off of them to make that process as easy as possible for them. And so I think those are really the 2 main considerations I wanted to bring up.
Thank you, Samantha. Really, all of you have brought up some important things to consider and questions that we can dive into. We thought that the next part to this is we'd give each of you a little bit more time to talk about some more detailed aspects of what you talked about in the introductions. And then just give the audience a moment at this juncture to start, putting your questions in the Q&A so that once we get to the next part of today's panel discussion, you can have your questions asked and answered as well. So I just wanted to go back to Ashlee at this point. And Ashlee, you've had a chance to look at the co-branded PolicyLab and VEC evidence to action brief. And in that, we eliminated a number of challenges and possible solutions for college health administrators, but we also realized that it was in no way comprehensive. So we kind of want to hear from somebody who's on the front lines, what solutions you'd like to see explored or implemented to move things forward. And I know you mentioned a couple of them in your intro remarks, but give you an opportunity to talk about some other things that you would like to see happening.
Yeah, thank you. I'm happy to be more specific. So the PolicyLab action brief covered a lot of the real challenges that exist for colleges and universities. A common thread through many of them is the amount of time and staffing required to review vaccine records of incoming students. In many cases, like I mentioned before, it's an entirely manual process, regardless of the size of the institution. The collection of vaccine records, submission of vaccine records, and review of vaccine records is, I think, an area that's ripe for technological improvement, like the utilization of AI. More importantly, all vaccine efforts, not just at institutions of higher education, but in all spaces, would be drastically improved with a national vaccine registry. This would reduce redundancy of effort and manual submissions, not just at the college campus setting, but as families move around throughout the United States. We're a very transient population these days, right? It's actually very rare for anybody to have the same pediatrician their entire life. So a national vaccine registry would really allow not only college and university settings, but family medicine practices and pediatric offices to have better, more real-time information that's talking to each other when people cross state lines for jobs or whatever it may be. But it's especially on college and university campuses, we spend so much of our time simply figuring out which vaccine students are missing rather than being able to jump right into action and getting them the vaccines that they need.
Thank you. Those are important points. Samantha, can you speak to what role you think students can play in those kinds of efforts and maybe any other ideas you have in addition to what Ashlee just suggested?
Yeah, absolutely. So I think that one of the real challenges, as many of my co-presenters have already mentioned, is that students also are not always informed about what vaccines they actually need for college. I think a lot of students kind of have the assumption that, their parents and their pediatrician got them the vaccines that they needed when they were kids. And a lot of people don't necessarily know that you need different vaccines for college, such as like the meningitis B vaccine, which most people did not need before that. And so I think finding ways to encourage students to be more educated about that would be a real benefit, because I think then it would also take some of the burden off of administration to have to kind of like having students take more ownership over both what they've already been vaccinated for and also what vaccines they need. It might take some of the burden off of administrators to tell students that, and it could be kind of more active on both ends in that way. And then I think one of the other real challenges can be that students are sometimes hard to motivate in this way. Sometimes it is easy for especially college students to feel, we're young and healthy, we don't really need vaccines, this is not a thing that's going to affect us. And like, the reality is that, some of them are right, but outbreaks happen on college campuses all the time. When I was a freshman, there was a mumps outbreak when I was in college. And so I think that we really downplay how important these are. And I think that finding ways to communicate that to students, and also even just make the process of getting vaccinated not necessarily more fun, but like more of kind of an event. I know that, for example, there are sometimes like health fairs and stuff, and maybe giving out like even just like a sticker or something could like get people talking about it more, and like encourage people to show up and get more information and encourage them to really take a very active role in their healthcare. I think that could both help students be more active in their decision making, and also potentially take some of the burden off of administrators to have to kind of actively play both roles in that way.
That's great. Some more great ideas there. Thank you. Kristen, you've heard some of what Ashlee and Samantha suggest. How do you think we can measure the effectiveness of implementing these kinds of things or addressing policies and programs? And what do you see as, kind of current areas of research that are really ripe for some investigation?
Yeah, this is I think a really big question. I think some of this depends upon our outcome of interest, right? I mean, the ultimate objective is to strengthen immunization programs, optimally increase immunization rates on college campuses. So certainly being able to measure that outcome is, going to be critical. And I think Ashlee really nicely outlined all of the challenges there, and really the importance of having better tools to help with measurement of vaccination, really a registry and other IIS solutions for campuses. I mean, I think that is really critical, whether you are trying to respond to an outbreak or implement your vaccination program. But I think what we also certainly have learned during this discussion is it really isn't just the recommendation or the requirement, it really is also about the implementation. And so you can have the requirement, you can have student health services, but to Samantha's point, you need to make sure that students feel like they can access them. And so I think what we need to do also is really to think from an implementation science perspective and understand which of those factors are contributing most significantly to the ultimate success of an immunization program. And so we can measure immunization rates, but I think spending some time really understanding what's going to effectively increase awareness, all right, and help support students' self-efficacy as well will be critical. So I would cite some of those things.
Thank you. And John, I'll pose the same question to you. As a researcher, what do you see as the most pressing questions for focus in this arena?
Yeah, no, thank you for asking. Yeah, no, I think a couple of really important points came up, and I'm thinking, think of this through like two different equity lenses. One is thinking through the lens of students, right? Thinking through all the students that come to college campuses. Who are the students that may face particular barriers or particular vulnerabilities around not having access to vaccines or not being allowed to consent to vaccines? And I think the other equity lens to kind of look at this through, and I think an area ripe for research, is what is the impact of decision making and young adult access on the broader community, right? All of the faculty and staff, which also do bear some of the consequences, right, of some of this decision making, as Samantha mentioned, when there's an outbreak, and I think many of us who've worked in college university campuses know this, when there's an outbreak among students, everybody gets upset, everybody is impacted, and the cases of most outbreaks aren't only felt by students, right? So it's not only the employees and the staff, but it's also the broader community overall. So through the first lens, in terms of thinking about who are students that may face particular barriers, right? We talked about students who may come from maybe more entitled backgrounds in terms of having parents who have refused vaccines, and so they may be even more empowered by those parents to refuse vaccines in the college years. But I'm also thinking about students coming, international students, right? Actually, I was thinking about that work of the manual work and labor of putting in the vaccines, and as you know, the international records can be particularly challenging, as there's a lot of different standards and types of vaccines around the world. And also, we've seen that students who are maybe first generation or coming from communities or backgrounds where there aren't as many resources, or insurance may be limited, and they face a number of access variables, may not have been able to participate in shared decision making, and may also need a little bit more time and attention. And I'm thinking about what Samantha said, right? If you want to lower as many barriers as possible for students, I really encourage taking a universal design perspective, right? Focus on the student who faces the most barriers, who might be the most resistant, and think about what might be helpful to them. Location are very, very important. But when it comes to young adults, it's also timing, right? So making available at night, on weekends, and flexible for students who may face some of those barriers. And then, yeah, and so I think it's important, I think, in thinking about the broader equity lens, right? I think it's also important to engage, to really keep vaccine requirements at a par with what's required for employees and staff, right? I mean, that really can set up some really interesting equity discussions across campus, right? And really making sure you're not only staying connected with the community and reflecting community values, but universities should really be leaders. I mean, what do they ultimately exist for, if not to prepare young adults, right, for their rights and responsibilities in the world as adults, but also as leaders in their communities, and so can maybe move the bar in some communities where there may be more resistance to vaccines. So those are some areas of research I thought might be interesting.
Thanks, John. And I think too, to the point that you made about the campus community, but then even the next concentric circle out, which is the community at large in which that campus lives and works, and students go out and shop and all those things. And do you have any thoughts? You spoke to the diversity and the equity thoughts related to students on campus and the different groups and needs. But for maybe our state health department folks who might be listening today, who are dealing with a diverse array of campus types in their communities. So that small rural college that Ashlee mentioned, that has one nurse versus a larger institution that might have a whole department. And how do we help that kind of diversity? How do we implement solutions across an array of campus types? John, do you have thoughts about that? Or okay, go ahead, Ashlee.
Yeah, I apologize. I didn't realize that was for me, but I can. Ashlee, you want to go first? No.
Go ahead, John.
Okay. No, I think in terms of connecting across communities, right? I mean, I think universities have, face some common challenges, right? And I go back to thinking about who are you engaging in terms of coming up with solutions. So I think about those students, right? And students who when I think about like what are the opportunities also that universities offer for students to develop their skills, and they're often related to when it comes to vaccines, for research, for community engagement, and often sponsor international travel around vaccines as well, right? And so I think these offer opportunities for inter-college, inter-campus kind of coordination and collaboration, right, around research, around shared goals for student education and student access. Certainly, well, Ashlee, I'll defer to you, but thinking about how some of the smaller colleges and universities can partner in terms of, when there are limited resources, I think is also an important thing to think about.
Ashlee? Do you have anything to add there?
No, not really. I mean, it is that. It's that college and university campuses care very much about the safety of their students. They care very much about vaccines, but it takes so much time and effort to simply verify the childhood vaccine series when people are coming in to college campuses, that's where all the time and the effort is right now. And whatever we can do to get us to be able to shift to focusing on catching people up on vaccines, or on focusing on Men B, or focusing on HPV for people who didn't get it as in their younger years, that's I can speaking with my American College Health Association hat on, I can tell you that that's where everybody wants to be able to shift, and we just need more technology support to be able to get there.
Thank you. Let's pause here for a moment to see if we have some questions in the queue. Rebecca, I know you've been monitoring that.
Yeah, thank you. We do have one question from Emily Silver, and it's related to incentives for vaccination on campus. So are incentives for vaccination effective for college students? And if so, what type? And gives the examples of, cash cards versus other types of giveaways. And just add some context that our health department often visits college campuses to offer free vaccines. And we have many people stop at our table, but few actually consent to receiving vaccines. So I don't know if any of the panelists want to pick that up and speak to that point about maybe how to incentivize and what is effective.
I can start, and certainly be interested to hear about experience from the rest of the panelists. My understanding is that incentives that they haven't been universally effective, I think probably as your experience has reflected. And I can just think of another instance of a study we did some time ago offering free vaccination. This was in a different setting. It was not on a college campus, but it was in a healthcare setting to encourage receipt of Tdap vaccination for caregivers of young infants, and offered a free voucher, to a pharmacy just down the street, to try to also make it as convenient as possible. And the intervention did not work at all, and that the voucher was accepted, but nobody was vaccinated. And I think that speaks to the importance of really understanding what the drivers are going to be of vaccination at that time. So the objective was to try to, there were a couple of other elements related to that intervention to try to make sure that there was some salience, right? Emphasize the importance of vaccination and try to address convenience with the free voucher at a nearby location. But I think convenience probably means something a little bit different to depending upon where you are at that time. So offering a free voucher at a health fair, it may seem salient and feel important at that time, but then there's some additional steps that would still have to happen, potentially, right, to maybe get vaccinated or, so I think that an incentive does not necessarily always address the factors that are really driving the decision to be vaccinated, I think is the key consideration. And I think the other thing to consider from an equity perspective is the potential for a feeling of kind of coercion. Why are you, offering an incentive to encourage vaccination? That could be an issue in some settings. But my understanding in general of incentives that have been used in a variety of settings is that they're not universally successful for a variety of reasons.
Yeah. I can share a little bit of a success there, but I do want to double down on what Kristen said, that incentives are not necessarily what's working for this particular population. Thinking about the work that we do at the University of Pennsylvania, we have an annual flu vaccine event. Flu vaccine on our campus is not required, but it is one that we feel strongly about recommending to students. And the way that we run that event is we make it as absolutely fun as possible. It is a 3-day campus-wide event, and not just us set up in a corner trying to catch students as they walk by. We have made it an event. We run it as both an emergency preparedness point of dispensing site drill for our staff, but we also make it, like I said, a 3-day campus event. There's music, there's candy, there's social media backdrops to encourage students to take pictures of themselves coming through the event. We make it fun, and more importantly, we make it free. And then it's run as a very safe and efficient event. And through these methods, we're able to vaccinate over 10,000 Penn students and community members every year, which is extraordinary. If I shift and put on my other hat, not all college campuses have that time, have those resources, or have that institutional buy-in to put that much effort into any sort of vaccine clinic, especially for a vaccine that's not required. But there are ways to do it. And I think even like Samantha said, there's ways to make it really accessible for students that help.
I love the idea of making it also a dual purpose event for the staff to get the emergency training as well. Samantha, from your perspective, do you have any other thoughts related to the student's point of view here?
Yeah, so I think the idea of making it like a really fun and engaging event is a really great strategy for this. I do have, in a way, like almost an ethical concern in terms of like offering like cash or like vouchers and stuff. Like I think we want to be careful in terms of what we're offering. I think if it's something small, I mentioned earlier, like if we want to give people stickers or something, I think that's okay. But I think we want to be careful that it doesn't come across as almost like bribing people or coercing people. Because I think that also almost may have the opposite effect, especially for college students, where they may feel like, if they're trying to like give me things to get this, then maybe it's not like required. Maybe it's not as much of a standard. And I feel like almost like kind of, if you make it free, I think people are like, oh, they're just like making it easy for me to reach like the requirements and they're making that accessible. I think if you're offering people like vouchers and things, they might feel like you're trying to coerce them. And I think college students especially can be very resistant to that. And so I think making it as fun as possible is probably more the direction that college students would be open to, rather than more specific like items or like vouchers, things like that.
Charlotte, if I can jump in, because I think Samantha's comments just segue to a question in the chat. If Samantha, if you just wanted to speak a little bit more, someone asked for for the group to comment on the use of student vaccine champions on campus, which I think you might count yourself as one of those, but if you wanted to comment on that.
So I think that one of the things about my experience that might make this a little bit unique is I went to a very, very large university. And so I think that makes my experience a little bit different than someone who may have been on a smaller campus where that may have been more effective. I wasn't actually super involved in specifically vaccines on my college campus. It was a little bit more removed from that. And so I think especially on large college campuses, it's important to maybe have students involved more at the institutional level and involve students in messaging and programming and really seeing like what students, like if students are getting vaccinated, why? If students aren't getting vaccinated, why? And maybe using that to inform it. And I think the considerations for a smaller university might be different. And I think I'm a little bit less qualified to speak on that. But I think that may be more of an opportunity to do a little bit more like on the ground messaging in terms of just getting people talking about it. But I think we really have to be conscious of what kind of university is it and what kind of messaging might be the most appropriate. And that may take a little bit of trial and error. And we want to make sure that that's something that people are open to. Like it may not all types of messaging are going to work the first time, but I think that's okay. And I think that might be a worthwhile effort to try a lot of different initiatives.
Rebecca, do we have other questions in the queue?
Yep, we have a question in the chat, takes us a little different direction on exemptions, essentially. So if the group could speak to, what you see as the potential population or public health concerns of allowing exemptions for religious or personal beliefs, so exemptions to vaccine requirements.
I can speak a little bit to that based on experience working at a couple different universities, and I do know that the landscape is changing at the state level as well. Different states, right? I mean, I know there's a number of efforts across different states, and some have been successful, such as I know in New Jersey, in terms of eliminating, state mandates for religious or personal belief exemptions. So that can be very, very helpful, as well as having state regulations that require college vaccinations. Also could be equally, can kind of counterbalance that as well. But ultimately, I mean, I do believe that ultimately it's the college administrators that make the decision about what access students have to programs, sponsored travel, to being at group events and things like that, based on their decisions around vaccines, and kind of reflecting on the last discussion that, someone who's giving a religious or a personal belief needs to be engaged. And I think the campuses and universities, like the most valuable people on campus are other students who are highly motivated to engage and educate and talk about, right? Students who have maybe immune conditions or immunocompromised, students who maybe have lost family members or ill family members at home and have to think about that when they go back and forth to campus. Students, certainly students who are connected with other schools across the university who are looking for research or advocacy or leadership opportunities to do more public education events. But I think we really do need to reach those students who are putting forward religious and personal belief to really understand where is that coming from. Last thing I'll say is that I found that it is at 14, right, where young adults start making decisions different than their parents, but they don't always feel safe making decisions different when the parents hold the purse strings. And so again, creating those opportunities, right? And again, what does it mean to give consent? A big piece of consent, it's synonymous with confidentiality, right? Can they get the vaccines confidential so that they can enjoy all the resources and opportunities of the university without causing a disruption to their to their family or to their life on campus?
There's some really important points. Did any of the other speakers have additional thoughts related to that question?
I have one additional point that I want to bring up, which is one of the things about exemptions that I have always had a little bit of an issue with is that different kinds of exemptions involve different levels of kind of proof. And so I remember during COVID, this was a big thing where I actually wrote an op-ed about this a while ago for my school paper, where for religious exemptions, all you had to do was write an essay. And I think they welcomed other forms of support. But in order to receive a medical exemption, you had to provide doctor's notes and medical records, and you had to have a whole comprehensive thing. And that was actually the subject of a lot more checking, and there was a much longer process that people had to go through to get a medical exemption as opposed to a religious exemption, which I thought was kind of unfortunate, because I think that people who need medical exemptions should obviously be granted those medical exemptions. But I think that if nothing else, we should be requiring people who are seeking other kinds of exemptions to go through a very similar process. And it shouldn't be as easy as writing an essay. And I think that different kinds of exemptions need to be held to a much more similar standard, because it almost seemed like for some people that even if they had a real medical exemption, it would have been easier for them to just get a religious exemption, because that would have been easier for them to obtain. And I think that that's kind of unfortunate. And I think that's an area that could be improved.
Yeah. And I think that's an excellent point, Samantha. And I think that there's certainly, been some work to well, we know that there's heterogeneity, right, in terms of the way in which different exemptions are essentially implemented. The burden of proof, so to speak, or that's needed for the submission and acceptance of an exemption, and that it can make a difference in terms of immunization rates, exemption rates. And I think then also to John's point that, it is kind of about what is the essential cost, right, of one's decision to pursue an exemption or to decline vaccination. And so does it have an impact on what you're able to participate in terms of your community involvement, ability to participate in certain activities, or to submit an exemption? Do you need to make sure that you pursue a certain amount of verification or participate in vaccine education? And all of those things can impact the ultimate decision to actually carry through with an exemption or the ultimate impact of declining vaccination.
Thank you. We're getting close on time. Rebecca, maybe we have time for one more question.
Yeah, well, why don't I put forward two that are essentially both, and see who wants to pick them up. They're essentially both sort of about tools in terms of driving vaccine uptake on campus. And one is about the involvement of programs such as schools of public health, pharmacy, nursing as promoting vaccination on campus. What is their role? And it can take the pressure off the health clinic when these groups are involved. And they cite an example of how that's worked for them. But then also someone asking about the use of social media on campus as a means of distributing practical information or as a tool to promote vaccine acceptability. So I'll just, in the interest of time, put those both out for you all to pick up.
I'll start that off, and happy to have my colleagues jump in here. Absolutely. I think all vaccination efforts on campus are not just one person or one unit's job. The flu clinic example that I gave a few minutes ago, we work very closely with our School of Nursing and use some of their students as vaccinators. So they both get real-time training as part of their community health course. But then students are part of the solution and part of the effort. And then related to social media, I want to go back to what something Samantha had pointed out, sort of about student agency, right? So if we were to do a social media campaign, let's say about HPV, we might get a little bit of traction. We might get 1 or 2 students who come to the health center and say, hey, I want to start my HPV series because I saw your social media account. But if we have students as part of that social media plan, and I don't mean just showing student faces, I mean actually involving students in the creation of the social media, really giving ownership of the social media plan to the students, any university is going to have a much better experience and outcome related to that. So it's just like community health on the ground. You have to include the community in what you're doing for that to be successful.
Did anybody have other thoughts to add to either of those parts to that question, Samantha?
Yeah, absolutely. I think that Ashlee, you just touched on one of the things that I wanted to mention, which is I think having students really almost like managing the social media accounts. Like I think that's a really great opportunity for student outreach and even just creating conversation and normalizing things like that on campus. So there are opportunities for, I know that there are some schools that already do this. One that comes to mind is I know the Yale School of Public Health Instagram account posts really fun memes and like informational things about vaccination that are really accessible for people my age and people in college. And I think that's a really great way of creating conversation that wouldn't necessarily have the same traction if students were not involved. And I think that students can really be such a good resource for creating conversation about these things. And I think that that is really, again, a way to take some of the burden potentially off of administrators by, if students are talking about this, if there's conversation about it, more students might come in and be like, I want to start my HPV vaccine series. I want to get vaccinated against meningitis B. And, you know, it might seem a little silly at first getting that information from Instagram or TikTok or like other social media platforms. But at the end of the day, that's what works for people my age and people in college. And I think that that's a tool that we really need to accept and use.
Thank you, Samantha. I think we have to stop there, even though it sounds like we could keep talking for a much longer time this afternoon. I think what we heard is that there are challenges, but there are also solutions, and that everybody has a role to play. The students, the parents, primary care providers, health departments, civic organizations, and campus staff and administrators. And so as we conclude today's discussion, I'd really like to challenge everyone who's listening today to think about your own role and whether there are things that you can do, not only to help make students more aware of and prepared for infectious agents, but also to help make campuses more impervious to the outbreaks that they cause. I'd like to thank again our fantastic panelists for joining us today, and thank you to everyone who tuned in. The recording of today's conversation will be available to view tomorrow. Just visit policylab.chop.edu or turn into the PolicyLab social media channels to find the link. Thanks a lot, and everybody have a great rest of your day.
Thank you.